national health policy
Okay.
as
It's
it
recorded.
affects
Yes.
states considering their own peculiarity. Nigeria have about 36 states, including the federal capital, and each of these states have its own peculiar nature, which is sometimes most likely different from one another, no matter how contiguous they are. Planning for recruitment, deployment and development of the required manpower, and then collaborating with key stakeholders. I have mentioned some of the functions of the Ministry of Health, of course, to supervise the implementation of the national and state policies, monitor activities of healthcare providers and service delivery facilities, including traditional and private medical practitioners, to ensure that they comply with national and state policies, sensitizing, educating, promoting the general public awareness on preventive care, coping and living with the sick, infected, and general hygiene. Of course, procurement of medical equipment, drugs, consumables, and other supplies for health facilities. Zamfara State, like many other states in Nigeria, have embraced the Health Financing Policy Reform Trust introduced at the national level in order to achieve more money for health, more health for money, that is value for money. Zamfara State has therefore kicked into the National Health Financing Policy and have provided various means to ensure that they participate in the state-supported health insurance schemes under the policy of the primary health care under one roof. And it is, of course, as we know, every person in the world has a basic right, and these rights include the right to health. And if we are talking about universal health coverage, we should see it from that direction. The objective of this presentation is one, to analyze the state capital and recurrent budgets and expenditures for 2018 to 2022. What we did was to review a 5-year period of budgets and analyze it and see what is the percentage of that and the performance of that budget, particularly in the state as it regards the health sector. We also did an assessment of health financing system in the states, its efficiency and performance, and we made necessary recommendations in order to improve public health expenditure in that sector. I'm sure I don't need to be talking about what is health financing, but for the purpose of just this audience, we should know that health financing is the function of health system concerned with mobilization, accumulation, and allocation of money to cover health needs of people individually, collectively in the health system. The purpose of health financing is to make funding available, not just funding, as well as set right financial incentives to provide to ensure that all individuals have access to effective public and personal care, as is said by the WHO in 2000. This is from the WHO, looking at the 3 dimensions to consider when moving towards universal health coverage. You cannot have health coverage if you don't look at who are the population to be covered. What are the services that you need to provide? What are the direct costs and proportion of the cost to be covered? And in any situation, we always have a particular pooled amount, which we have the current pooled funds, and of course, to what extent has that been able to cover the non-covered, which you are talking about the universal health coverage. And what is the gap that you need so that you'll be able to cover most of those who are not covered or not insured by the services? And what are the services that are included? We know with most health insurances, you have some of the services that are not covered by the health insurances. So how do we do that? Looking at the universal health coverage, if universally you want to cover everybody. This is an important highlight. The panel discussion this morning we had. In particular, Nigeria and many African countries in 2001 in Abuja have participated and committed in an agreement that they will be giving 15% of their annual total budget to health. Where is it? Where are we? In 2021, the Nigerian government only allocates 3.7% of the total government budget to health. And as we progress in this discussion, we will see how far have Nigerian government and other state governments, in particular subnational governments, how have they been faring, particularly in allocating budgets for the health sector. This is just a preview of the 2021 budget allocation in the health sector of Zamfara State. And you can see the health sector is submerged in the social sector. And that represents about 22% of the total sector allocation for Zamfara State in 2021. And that is where you have education, health, social welfare, women affairs, and what have you. So what exactly goes to health in that direction? The state government, of course, will definitely depend on source of revenue. The Zamfara state government mobilizes revenue from various sources. The volume of revenue available to the state likely determine fiscal space available for government to spend on any sector, including health. We know resources are, of course, very limited, and most of the subnationals, including the national government of Nigeria, are dependent on the crude oil. So all our revenues depend on what comes from the statutory allocation. The 5-year government revenue review shows that there are various other sources of revenue available from government, which include the statutory allocation, internally generated revenues, internal and external loans, and other sources of revenue. And of course, we have the international development partners supporting in various ways. So the state's total revenue per annum fluctuated during the period we reviewed. It increased slightly from 137 billion in 2018 to 160 billion in 2022. That is in Nigerian naira. What we are trying to do is to look at vis-a-vis the performance of health indicators, in particular maternal and reproductive health indicators. As you allocate funds, you want to see how does that funds help in achieving the universal coverage vis-a-vis certain indicators